Hi, I'm Dr. Kate Balestrieri. I'm a licensed clinical and forensic psychologist, a certified sex therapist, and the founder of a therapy practice called Modern Intimacy.
Welcome, Dr. Kate. I adore you as a friend and a colleague and a professional. Dr. Kate is so incredible. I've been blessed to know her over the years. And I really wanted to ask you because I know so many people ask me this when I have brought you up in conversation, whether professionally or a private conversation. What would someone see a sex therapist for? That is a question I get asked all the time, and I'm sure you do too.
Totally. And the answer is people can benefit from seeing a sex therapist anytime they want to have a better understanding of their own sexuality or their relationship with sex or the sex that they are or are not having. So lots of folks will come in because there's a desire discrepancy between themselves and their partner, or they'll come in because they're healing from sexual trauma and they want to get a stronger footing on how to move forward. They might come in because they're not having orgasms either by themselves or with a partner. They're experiencing pain during penetration, or they want to learn more about how growing up with sex negative messaging has influenced the shame they feel around desire. So, lots of unpacking around sexuality and lots of goal setting around really creating a path to empowered and sustainable pleasure.
I love that. So basically, anything to do with enhancing your sex life,
Mhm.
you should be coming to Modern Intimacy and meeting with a therapist to really explore that and open yourself up more that
Mhm.
way. So when you said that people come see you for pain with intimacy, I know that can often be, from the pelvic floor, but
Mhm.
that also is a lot of feelings and emotions
Mhm.
and really impacts a relationship a lot. And so when someone's seeing you, do they sometimes also work with pelvic floor therapy at the same time?
Yeah, absolutely. It's probably one of the first things that we do is ask folks to go see a pelvic floor therapist or pelvic floor specialist so that they can rule in or rule out any pelvic floor dysfunction that might be biologically originating. Certainly, there's a big connection between mind and body. So, for a lot of folks, where there's anxiety or where there is trauma, there may also be emotionally driven pelvic floor concerns, but we want to make sure that folks are getting the medical care that they need so that we can, again, either rule it in or rule it out as a causational factor. And then that gets incorporated into our treatment plan.
I love that. So I want to ask you, what are some common misconceptions about sexual pleasure? Like
Mm.
psychological, emotional, relationship wise?
Yeah, one of the biggest misconceptions about pleasure that I hear is that it should only happen within a partnered context and within this deeply connective partnership. And don't get me wrong, that can be beautiful and wonderful. But I'm a big firm believer in the reality that we can create pleasure within our own bodies. And the more we are familiar with creating pleasure in our own bodies, the better our sex life is in general, but also the better partnered sex we have because the more we take the time to really deeply understand what our pleasure points are in our own body, the more we can be an active participate in cultivating that partnered pleasured experience. But that's one. Two, I think a lot of folks who identify as women really struggle with giving themselves permission to prioritize and center their own pleasure. And what I mean by that is that they'll often think like, oh, well, my partner needs to feel pleasure. That's more important than my pleasure. And that is just such a bummer. I know it comes from a lot of deep conditioning socially that most of us grow up with, but we leave a lot of pleasure on the table when we're not expecting reciprocity around prioritizing pleasure.
Yeah, I definitely think that is a large one that so many women have. It's
Mm-hmm.
all about their partner and without thinking, I matter just as much, it's equal, and I
Mm-hmm.
should be getting things from this as well.
Mm-hmm.
So those are great. So shame and embarrassment is a huge thing when it comes to pelvic floor dysfunction or, ways we grow up. So how can women overcome shame and embarrassment when they talk about the pelvic floor and their sexual health? I know so many women who are almost embarrassed to say the word sex out loud, as if it's a taboo and bad word, and it's
Yeah.
just a word, right?
Yeah.
And to really talk about the pelvic floor, and they have this shame around it, and it's a stigma and shame I would love to go away for women. So I would love you to be able to share some insight into that.
Mm. Yeah. I mean, look, I think we, as humans, have been really conditioned to be embarrassed of bodily functions, even though we all have them. So when something is happening in our body that feels out of our control, we can feel extra vulnerable around those kinds of symptoms or things that are happening. And that creates this big fear that if I speak to it, if I speak it out loud, someone might believe I'm flawed. Right. So I think the first step is to really think about your own self worth and try as best you can to detach how you see yourself as a worthy human from what's happening in your body. Because we all have things that happen in our bodies and happen to our bodies and from our bodies. And that's a part of being human. And it does not change our worthiness as human beings. We get embarrassed about stuff like that because I think we're, again, socialized to experience illness or dis-ease or discomfort or something not working the way we think it should as some sort of inherent flaw. But let's look at it instead as information, right? So kind of shifting away from this means something about me, let's think about it differently. What could this mean in terms of what I need or what my body needs? And I
Yeah.
think when we move in that direction, we can start creating more of a respectful relationship with our body and the symptoms of what's going on, the things that our body is telling us that we can
Yeah.
address. And we can bestow on ourselves a little bit more grace and respect, and also normalize that every single body has stuff,
Oh,
right?
for sure.
We all have stuff. And sometimes our stuff maybe is less talked about. So the other thing I would say is talk about it more. The more we lean into the things that bring us shame, the more we realize, oh, that actually doesn't carry that much power. I know a lot of women, when they start going into perimenopause, don't want to talk about the symptoms they're experiencing because they think it means something about their value again. And my answer to that is, I know it's scary. And how about joining a support group, or how about getting a couple of friends together who are similar in age? I bet they're feeling the same way. And wouldn't you know it, when they start talking about these things going on, they feel so much more empowered to find solutions and to get support around it. And that can really, really help.
I love that because it is so true when you start talking about whether it's the perimenopause, pelvic floor dysfunction, sexual health, people sometimes think that they're the only one feeling this way and they're ashamed or embarrassed. When you really start being open with women,
Mm-hmm.
so many of us have the same thing or such a similar experience, and there's
Mm-hmm.
such comfort for women. Wow, I'm
Yeah.
not alone. I thought I was the only one having pain when I have
Mhm.
sex, so I don't want to. I didn't realize other women are also experiencing this, and there's solutions. I didn't know that because I wasn't talking about it. So
Exactly.
I love that. That's so powerful. So I want to ask you, for women who feel disconnected from their bodies and sexual pleasure, what advice would you give them?
Yeah. Well, I would say that it's really common to feel disconnected from your body or from pleasure at some point in life, and sometimes multiple points in your life. So, again, like, let's think about this as information, it's an opportunity. And I might ask you to consider what kind of relationship you want with your body, and what do you want your relationship to be with pleasure. And let's start by getting some ideas. And from there, you can work on breaking down those ideas into really small, digestible, micro opportunities. So you can take small shifts. As a lot of the women that I work with, when we start talking about things like getting embodied or prioritizing sex or prioritizing pleasure, one of the most common things I hear is, oh, I don't have time for this.
Yes,
right?
a lot of women share that with me too. They
Yeah.
say they don't have time for it.
They say they don't. And I get it, right? Like it's hard, especially if you have kids and you're the primary parent and you're doing it all like so many of us are. So it is really hard to make time, but you do have an opportunity to make time. But what I say is you don't have to make a ton of time at first, right? This is a
Hmm.
practice and it starts by creating these small moments, small sustainable moments. So it could even be setting the alarm on your phone for 1 minute or 2 minutes. Most of the people I know can steal away 2 minutes in their day. And you don't even have to do anything sexual. Maybe getting embodied is about putting lotion on in a slower, more intentional way and really noticing, like, wow, I love the way the lotion feels on my skin. And like really taking the time to work that into your skin. Maybe pick a new body part each day so that again it's really small and these micro moments, and the same with pleasure. Like think about the everyday things that you do, like little self-disclosure, I had a peanut butter cup right before we got on this call.
No, I had one about 20 minutes ago.
They're
It was a Trader,
delicious.
it was a Trader Joe's one.
Yes. Oh, mine was a Justin's. They're, but these are my favorite little like treat in between session. And the thing is, I can still taste it. And so I'm sitting here right now, and every time I'm talking to you, I can taste it. And I'm like reveling in that taste. And so this is a way where I'm like importing my pleasure awareness into the everyday experience of what we're doing. And so you're already doing things throughout your day that you can savor more. And I think that practice gives us a lot more access to pleasure. And then guess what? It's like a drug. You want more of it. And so then you start making more time.
I love that. It is really powerful
Mhm.
to do those small moments. That is really funny. We both just had a peanut butter cup. But I do like that. I think of when you said that too, I picture brushing my hair and
Yeah.
how I love how it feels against your scalp and just moments like that that we take for granted that we do every day, how
Mhm.
pleasurable those could feel, even though they're not sexual.
Exactly. Yeah. And I think that's the place to start, right? Is creating I mean, you can start wherever it feels good for you if you want to start with something sexual or not. But sometimes going right into sexual pleasure can feel a little daunting. So for those folks, I say, let's start in a non sexual thing. So that could look like getting some fresh berries and like really sitting down to savor them when you eat them, or getting a new scent that you like and taking the time to really smell it and inhale it and sit with it. Like anything that involves the senses and savoring what you enjoy.
Well, and so much of what you just said really reminds me of how we can get so busy or conditioned to just turn off how we feel almost
Mhm.
about everything. So we're just going through the motions day to day of life in general. So we get so detached from pleasure and feeling good and those simple things of the berries and eating the peanut butter cup or brushing your hair or the lotion, and to the bigger, more intimate moments because we
Mhm.
just shut it off because we're busy. Like we don't have time for it. So
Yeah.
I do love that so much. So I wanted to talk about some misconceptions and topics really about like religion, trauma, purity culture, things like that, the
Mhm.
shame and sex negativity. I mean, there's just a lot that's packed into all of that that we all have, maybe small experiences with, or some of us have had huge monumental experiences
Mhm.
with that, and some of the more misunderstood reasons for pain during penetration.
Mhm.
So it's a lot I just kind of threw at you. We can unpack it slowly, but I
Yeah.
really think society and the culture we grow up with and the household we grow up with and the parents and our family dynamics and their comfort level and beliefs
Mhm.
impact us so much, and then our personal experience.
Yeah. Yeah. I mean, I so get the question. Let me try to answer it as best I can. And I want to start by saying, like, people don't have to stop being spiritual or religious in order to get to a place where sexual pleasure is accessible. And for some people who are spiritual or religious, maybe this is a non-issue. And for a lot of folks that I work with, there's a tremendous amount of religious trauma that has taken shape around sexuality and a lot of sex negativity. that has separated people from their permissions, their own self-sovereign permissions around pleasure and prioritization and um, bodily autonomy and really like desire. So if that's something that has been an impact, it can be really important to start really looking at what is my relationship with religion. um, am I okay questioning some things? Do I have some spiritual fears or existential fears that if I say yes sexually, something spiritually might happen that I'm not okay with? And I think that there's an interesting balance between kind of coming into your own sexually and reconciling the fact that pleasure is a human right? With a religion that might tell you pleasure is only okay under certain circumstances that might feel overly restrictive for you. And if that's something that you're navigating, that can absolutely lead to things like pain during penetration or lower desire or a lot of shame. So, it's not always a problem for folks, but for many folks, it is a problem. And so I think there's a lot of people that you can talk to help you figure out how do you make sense of maybe these conflicting and equally important domains of life.
That's so powerful and so true. I think religion is, you know, different, it can be different for everybody, mean
Mhm.
different things. And again, it doesn't mean you can't believe in a certain religion, but maybe what works for one person within that realm of religion, maybe you can have a different viewpoint and that works for you and that's okay. You
Mhm.
know, and maybe your friend has a different viewpoint and that's okay too, but really
Yeah.
being honest with like I'm okay with this, or
Yeah.
hey, I'm just not comfortable with it regardless of a religion or not a religion. It's for
Mhm.
me or it's not for me. So I think that's
Right.
really important for people.
Yeah. Yeah, absolutely.
Now, let's talk a little bit about sexual trauma. It's a lot to unpack, so we're going to do more of a surface level
Mhm.
conversation because I've worked with many women who have had sexual trauma. To me, I believe as soon as I know someone has sexual trauma, I would want to refer them out to a therapist, a sex therapist, someone who's adequately equipped to deal with
Yeah.
it. Because even if they want to discuss something with me, I am not trained to help deal with the emotion and
Right.
mental aspects of that. And so, if we could just talk briefly about that, because there will
Mhm.
be some people who listen who have had some past sexual trauma,
Mhm.
and when to seek help and how to deal with that and navigate that a little bit.
Yeah, I really appreciate your thoughtfulness around this question because every survivor is a little bit different in the sense that some survivors want to run full steam ahead into what they believe is a solution and they feel very empowered getting sexual, becoming sexual, addressing things that might feel painful and really taking the reins. And there might be other survivors who say, you know what, I need to ease into this a little bit more gently, and I'm not sure where to start. And I think having a sex therapist or someone who's trauma informed as your therapist in both situations is really powerful because, first of all, you don't need anyone's permission to take the path that you want. So that's not what I'm suggesting here. But it can be really useful to have a space that is neutral to help people process what elements of their approach have been helpful, not helpful, and why or why not. And sex therapists are trained specifically to help folks understand, their own relationship with sex, and again, how to really turn something that was painful into something that is powerful and empowered and self-governed. And that's what a lot of survivors are struggling to get to is that place of self-governance and self-sovereignty when it comes to their bodies and when it comes to their pleasure. So for a lot of trauma survivors, one of the biggest long term effects is feeling like your body was not yours in that moment, or your body was overpowered, your boundaries were overpowered. And that sense of powerlessness can engender a lot of difficulty when it comes to sexual pleasure, especially when we think about the fact that pleasure often requires a kind of surrender, right? So a lot of survivors will reach this like point where they really want to feel a certain way and they are scared to surrender into it because it feels more powerful to stay in control. And so there's a bit of a lockstep that can happen there. So working with a sex therapist can help, move this mind-body connection into a place of unity so that there can be a developed sense of safety in one's own body and in the sexual circumstances that you're seeking out.
Yeah, I do love that. I notice many women, even without trauma, really have turned off that connection with the pelvic floor, that root chakra. Just the sensation isn't there. They've just turned off any awareness of what's going on, and whether it's sexual trauma or not. I love that the exercises help, install and restore some of that power, that you can feel it in a non-sexual way. But I do think working with a therapist, a certified sex therapist, can be so powerful, because even just with movement, whether it's pelvic floor or full body, people can really feel and have emotional releases. And to be able to have a qualified therapist, to be able to have a great sounding board, great advice, really how to teach them how to process those feelings is so powerful.
Mm-hmm. I agree.
So I love that. And I wanted to talk real briefly too. It's similar to what we talked about, but growing up, my mom never talked to me about sex. And I think so many women are not talked to, and that's why they think it's shameful, or, hey, you can't talk about it. It's only behind closed doors, or they're not even talking to their partner about it, let alone they're not
Mm-hmm.
comfortable themselves. They would never talk to a partner. What advice would you have for someone who just has no comfort, bringing it up in a conversation because they're just so uncomfortable themselves?
Yeah, yeah. I mean, it's hard to give blanket advice in this situation because I want to respect the nuances that come up for different folks around why they feel afraid to speak about sex. And for some people, talking about sex out in the open can come with real world consequences. So I want to honor that. But when we're not talking about safety issues, what I would say is similar to what I said earlier. The more you start talking about sex or immersing yourself in things that bring you more knowledge about sex, the easier it gets. The more vocabulary you have, the more you can speak to what you're thinking or feeling. And that's really powerful. And it creates a lot of resonance in the body. And when we feel this resonance between what we know and what we know in our bodies, ooh, that's powerful. That is a shift. That is a real shift. So, if you don't want to talk to your friends about it or your partner, that's okay. You can find support groups or maybe start reading as much as you can about it. There's so many great books written by women for women about sexuality and pleasure to help them understand their anatomy and their perspectives and their needs and their wants. And again, knowledge is power, and power is pleasure.
Oh, I love that. Such a beautiful and response. I love everything. Um, so I want to talk and ask you how women can generate more confidence during sex. And again, this is a very general thing because there could be some underlying issues, but generally speaking, what can women do to become more confident?
Yeah, this is a tricky question again because everyone's difficulties with confidence probably are rooted in something a little bit different than the next person. But one of the things that comes to mind for me is the feeling of getting out of your head and back into your body. So frequently we start to judge ourselves and spectate what we're doing instead of really feeling what's happening during sex. And I find that quieting the noise, right, or rather abandoning the noise, you can leave it up in your head, but bring your attention back down into your body and try to think about where you're having contact, either with yourself or with a partner. What feels good? What doesn't? Are you honoring that? Are you setting boundaries? Are you saying no? Are you saying yes? Are you enjoying? Are you savoring the sensations? Re-engage with your five senses and get out of your head and really think about, like, what am I smelling right now? Do I like that? Is it pleasurable? If not, what can I change about that? Do I like what I'm seeing, right? That can be in your partner or the room that you're in, right? Is the aesthetic pleasing to you? If not, how can you change that? Um, Same with taste, touch, and what was the other? And sound, right? Like really indulge your senses. And when you can stay embodied and in a sensory place, it's a lot easier to sort of forget all of that noise that's judging you. But
Yeah.
there are other things that you can do too. Um, you can move into a place of body positivity. For some people, that feels really hard. And I say, okay, then how about body neutrality, right? Can you say to yourself, I don't have to love this part of my body, but I also don't have to hate it. It doesn't have to be great, and it also isn't bad, right? Can you move into a space of my body is? And once you're in a place of neutrality, that becomes a lot easier to love and even appreciate some of the things like feeling your belly jiggle during sex or wondering like what's my partner's POV right now? Who cares? What does it feel like? Right? They're
Mhm.
not running from the room screaming, so just
No,
enjoy
they're
it.
happy to be there.
They are. They are. And they've got all kinds of stuff on their bodies that I'm sure they're insecure about too. Right? So really just remembering we're all humans. None of us are perfect. The only people who are perfect are airbrushed. That's not real,
Yeah,
right? Like all of us have the ability to really challenge that sort of spectatoring and become more embodied.
I love that. Wanted to also ask you, how can someone develop a safe space for reclaiming pleasure?
Hmm. Do you mean a safe physical space or safe emotional space? Or both?
Both. I know there's a little bit there if someone's with a partner that maybe really isn't safe, that's not going to apply because they
Mhm.
really could potentially be in an unsafe situation. But for someone
Mhm.
who's in a more of a relationship that is safe to discuss and things like that, that there is
Mhm.
safety within it for
Mhm.
that type of relationship.
Yeah, I mean, aside from really abusive relationships where it's not safe to bring anything up, and I trust that people in those relationships know the boundaries that they want to, that they want to be mindful of. Um, Aside from those relationships, I would say it's really important to think about what safety means to you. In my upcoming book, What Happened to My Sex Life, I talk a lot about creating a safe enough context. And so I say that because safety isn't always a binary experience, right? It's not like, oh, I feel safe or unsafe. It's often gradations of safety. So it might be that when your partner's in a grumpy mood, they're not as emotionally present for you, but you know they're not going to hurt you or they're not trying to hurt you. So is that safe enough of a context for you to bring some of your needs into a conversation? I don't know. I'm not you. All right. So really thinking about like what for you constitutes safe enough for you to feel like you can be in your body, and then I would say start moving into taking steps to make that happen, whether it's removing obstacles to safety or adding supports, either internal resources that you have, like more emotion regulation skills, for example, or um, taking a medication that you know keeps you safe from symptoms of a mental health condition. Or is it relational safety? So maybe you have to set different boundaries with your partner of like, hey, I want to have 2 times a week where I'm just engaging in solo sex on my own so that I can explore my fantasies without having to worry about another person being a part of that until I really know what I like or don't like. Then I will bring it to you, right? You get to set the boundaries that help you curate the space that you need to experience whatever it is you're hoping to experience, or even just the exploration to know that, because a lot of women don't know what they want yet. They don't know what turns them on or what they want to play around in terms of fantasies, and that is okay.
I love that. That's so powerful. So, what exciting projects are you working on right now?
Yeah, thanks for asking. As I mentioned before, I have a book coming out in February 2025 called What Happened to My Sex Life. It's basically a sex therapist guide to understanding why women get disconnected from their desire and how to get it back, how to recultivate it.
I'm so
So it's
excited
an
about that.
exciting read. Yeah, thanks. Um, and I've got some interesting research coming up in the next year that's looking at sexism and the implications on people's sex lives. So stay tuned. And if you'd like to participate in any of that research, you can go to modernintimacy.com/newsletter sign up, and we'll be sure to keep people posted of when we're doing recruitment for our upcoming studies. And there's a couple of other things going on. We have a new course on our website that's available called Righteous Rage, which helps women get in touch with their anger in really constructive ways, especially as it relates to pleasure. And yeah, we've got all kinds of groups starting for sexual health in 2025. So there's a lot on the horizons.
And can you tell everyone a little bit more about modern intimacy?
Mhm.
You can help people in many different locations
Mhm.
and provide a lot of resources. So I just want someone who's listening to understand more, of how modern intimacy is might be able to help them or a friend of theirs.
Yeah, thank you. Yeah, modern intimacy is a national therapy practice. We have therapists and psychologists licensed across, I believe, 13 states right now. So we're in New Hampshire, Connecticut, New York, Florida, Illinois, Minnesota, Texas, Colorado, California, Washington, D.C. I know I'm forgetting a couple, but there's a few more in there. And then we have a somatic sex coach and a relationship and intimacy coach on our staff who can work with people internationally. And we serve folks in 3 languages, in English, Spanish, and Farsi. We have a really diverse, multicultural team. We're a super inclusive place, and we have lots of points of access. So we will work with folks individually for therapy or coaching, couples therapy or couples coaching. We also have a lot of courses that are available on demand starting in 2025 that help folks address different elements of their sexuality and different goals they might have. And we have group therapy that we have going on. And we do lots of different events and all kinds of fun things.
Well, I'm glad I asked because I didn't know all of that myself either. I
Oh,
knew a lot of what you had, but
mhm.
several things in there, I'm like, I didn't realize it was now 13 states. I thought it was a little bit less and
Yeah.
3 languages. It's so amazing what you and Modern Intimacy are doing.
Thank
I would
you.
recommend to anyone who wants to work with a sex therapist or coaching or anything you have,
Yeah.
you and your entire staff is incredible,
Oh, thank you.
compassionate, qualified, and just incredible. So, anybody listening who is even thinking you might need this type of resource, I would definitely go to Modern
Yeah.
Intimacy for that.
Thank you. Thank you. Yeah, we don't just treat sexual issues. We work across a whole spectrum of things related to mental health, sexuality, relationships, trauma, addiction. So a pretty wide reaching, umbrella of services.
Well, I do think it's important for people to realize as sex therapists, you can deal with the sexual issues. But yes, like
Hmm.
you said, you're able to deal with the addiction and so many
Hmm.
other issues
Hmm.
or, life stages that someone's
Hmm.
going through. It's not just sexual.
Hmm.
And I do think that's great. I mean, even when I've had great discussions with you, I'm always learning from you because you have
Oh,
such a wonderful perspective. Just you're trained in like therapy and mental and emotional health. And so I always love, learning and getting your insight
oh,
into
thank
life.
you. Thank you. I always love our conversations. I learn so much from you too. I didn't know how much I didn't know about pelvic floor health until you and I met. And so I'm really grateful for the education too.
Oh, thank you.